people to provide care. It's important for us to have a understanding. So we need to be familiar with the structures of the human body, and we must have an understanding of how these structures function. So we're going to cover the human body. Is going to be a basic review of that. So once we know the structures and understand how they work, then we can start to look at abnormal function, which is pathophysiology. And this is what we see in the field when a patient has a problem. All right, now introduction. You must understand the basic structure and functions of the human body. This knowledge will help you to understand the problem the patient is experiencing. It will help you to perform an adequate patient examination, and you will be able to communicate your findings to others. And of course, you will be able to provide appropriate emergency treatment. Now, you must be familiar with the normal anatomic position. So what you're seeing on the slide now is what we refer to as the normal anatomic position. So anytime we approach a patient as responders, we always picture the patient this way, or we will position the patient on their back in a supine position, and we think about the patient in the normal anatomic position. Now, in the normal anatomic position, the head is in a neutral position. The palms of the hand are facing forward, and the thumbs are pointing outward. And it is the patient's right and left. So there are some anatomic terms that you need to be familiar with. So let's start with right and left. When we talk about right and left, it is the patient's right and left, not your right or left, the patient's right and left. Then you have the anterior portion, which is the front, and you have the posterior portion, which is the rear. And then there, that yellow line that comes down the center and cuts the body into two equal halves is referred to as the midline. Now, the inside portion, no, let me not use that. When a structure is closer to the midline of the body, it is referred to as medial. When a structure is further from the midline of the body, it is referred to as lateral. Using the forearm, the lateral aspect of the forearm would be the side where the thumb is found, so that would be lateral. The medial aspect of the forearm would be the side where you have the little finger. So that's the medial side because it's closer to the midline. Now, if a structure is closer to the head, it is referred to as superior, right? The eyes are superior to the mouth. If a structure is closer to the feet or away from the head, it is referred to as inferior. So the foot is inferior to the knee. Then we have what is referred to as proximal and distal. So let me draw a bone here. All right, so this is my bone. Now the term proximal and distal applies to long bones in the body. So proximal and distal is specific to long bones. Let me draw another bone over here. So every long bone in the body have a distal end and a proximal end, right? Every long bone in the body. And the mid region of that bone is referred to as the shaft of the bone. Now, we don't say in EMS, the man broke him hand right there, so over there, so close to that side there, on the left side. No, man, close to this, so, right? We don't say it like that in EMS. The patient has a fracture to his right femur distal end. That is more specific, right? So distal means that it is away from the trunk of the body. So the distal end is away from the trunk. The trunk of the body is the chest, abdomen, and pelvis without the head, arms, and legs. That's what we refer to as the trunk. So again, the distal end of a long bone is the portion of the long bone that is away from the trunk of the body. And the trunk of the body is the chest, the abdomen, and pelvis without the arms, the head, and the legs. The proximal end of a long bone is that portion of the long bone that is closer to the trunk of the body, right? Now, let's see if, all right, how do I clear this again? Oh, let's see if that was understood. So this is a question. If you have a patient, so let's say we have a patient that fell on their outstretched arm, stretch the arms out to break the fall, right? That patient is complaining of pain to the forearm, right? Pain to the forearm just below the elbow. So the patient fell on their arm, they're complaining of pain to the forearm just below the elbow. Is that distal forearm or proximal forearm? If you have the answer, just raise your hand for me. Go ahead, Karine.
It's the distal.
That would be correct. No, sorry, that wouldn't be correct. You said distal?
Yes, that's what I said.
That's not correct. So
All right,
come again.
repeat what you said earlier.
All right, so let's break it down. My drawing is not that good, but let's try again. So let's say this is the hand, right? And so that's the hand. This is the elbow joint, right? And the fracture is here, right? This is the fracture. So the forearm bone is fractured. This region is the shaft, and this is the area closer to the wrist. Now, my question to you, Kerry, which portion of the forearm would be closer to the trunk of the body? Would it be where the fracture is or the wrist?
Oh, where the fracture is.
Good. So if it's where the fracture is, it means it's closer to the trunk of the body. So that
Oh,
would
so
be proximal.
proximal. Okay.
Got it.
Got you.
Good. All right. Now, if that patient has a injury to the ankle, so they have an injury to the ankle, right? So that's the leg we're talking about, and the injuries at the ankle. Would the ankle be distal or proximal? Anybody can answer that question? Go ahead, Mr. Allen. Mr. Allen, go ahead.
You said the ankle, the inferior.
Yeah. It is inferior, but would it be distal or
So be
proximal?
distal.
Okay, that would be correct. Mr. Walker, you have your hand up. Go ahead. All right, not hearing anything here. All right, go ahead, Mr. Walker.
Yes, I was saying the same thing. It would be distal.
And that would be correct. So you are correct. Thank you. All right, so out of all of the anatomic terms, distal and proximal is always the one that is difficult to remember or confuse students. So just pay attention to that one. All right, now the standard anatomic position is a person standing and facing you with the arms at the sides and thumbs pointing outward. Anterior is the front surface of the body, posterior is the back surface of the body. Midline refers to an imaginary vertical line drawn from the head to toe that separates the body into a left and right half. Standard anatomic position, medial, closer to the midline of the body. Lateral, away from the midline of the body. Proximal, close to the trunk of the body. And the trunk is the chest, abdomen, pelvis, without the head, the arms and legs. Superior, closer to the head. Inferior, closer to the feet. Right? And that would be it for anatomic terms that you need to be familiar with. Now let's look at the respiratory system. The function of the respiratory system. Go ahead, Mr. Hawthorne.
Yes, morning.
Morning.
So lateral in that term would actually be moving in the x-axis direction.
Moving into what?
Looking at it in terms of axis, in terms of the x-axis direction.
Not sure about the x-axis, but if that's how you remember it, work with that, right? That's a bit too complicated.
I use x and y in terms of the midline would be more that separating line in the center of the body.
Yes.
So looking at it from the person standing straight up then.
Okay.
All right. Then I just use that intersecting point to say it's going away from. Well, that's how we used to remember it.
If that's how you remember it, go right ahead.
All right, cool.
Yes. All right, now the respiratory system brings oxygen into the body and removes waste, gas, or carbon dioxide. Right, so that's the primary role of the respiratory system. And in order for the respiratory system to function effectively, a patient must be able to ventilate properly. They must be able to bring in oxygen molecules in the blood and have that oxygen molecule bind to Go ahead.
Quick question before you continue. The material that you're using,
Yes.
will this be provided?
Yes. That's
Okay, will be sent by email so we can just browse through it.
hold on. You guys don't have your textbook.
Repeat.
Have you not been issued textbooks?
Listen.
No,
me
they
get back.
haven't been issued to us as yet.
Okay. All right. Okay. All right. So via email then.
Thanks.
Yeah. Yes, Mr. Harton.
Yes, and in saying that, we're actually trying to keep up with what all that the pace at which you're moving. I'm actually making notes and all of that, trying to grab all of this in.
All right.
Yeah,
Is that your way of saying I need to go slow?
something like that.
Well, just say that.
All right, cool.
All right. All right. So the respiratory system, in order for the respiratory system to function effectively, patient must be able to ventilate. There must be good oxygenation, and then there must be good respiration. So the structures of the respiratory system include the upper airway, the trachea, the lungs, the ribs, the bronchi, and the diaphragm. And the diaphragm is a very important skeletal muscle to breathing, right? So the diaphragm is essential to a patient's ability to ventilate. And when we talk about ventilation, that is the mechanical action of breathing in and out. So this is inhalation and expiration, right? So it's inhalation and exhalation, or inspiration and expiration, the mechanical action of breathing. So the upper airway, the respiratory system is divided into the upper airway structures and the lower airway structures. And the main function of the upper airway structures is to warm, filter, and humidify the air that we breathe in. So that's the main function of the upper airway structures. WHF, warm, humidify, and filter. And that function is better carried out when we breathe through our nose and when we breathe through the mouth. So that's the main function. Now, the lower airway, when we start to talk about the lower airway, these are the structures below the vocal cords. So you have the trachea, which leads to the lungs, right? I have a right lung and a left lung. The right lung has 2 lobes, the left lung has 3 lobes. And it's like that. What am I saying? The right lung has 3 lobes and the left lung has 2 lobes. It is like that to facilitate the position of the heart and the great vessels. Now, this space, there's a space between the lungs where the heart and major blood vessels would be. That is referred to as the mediastinum. And then just below the lungs, you have the diaphragm. And as I mentioned before, the diaphragm is a very important skeletal muscle to the process of ventilation, which is breathing in and breathing out, mechanical action of breathing. So the trachea goes down, and the trachea forms the bronchi, which further breaks down into bronchioles, and at the end of each bronchioles or branches, there are ear sacs, where the exchange of oxygen and carbon dioxide will occur. So the airway consists of the nose and the nasopharynx. Now, that term nasopharynx means the posterior portion. So when you see the term nasopharynx, it refers to the posterior portion of the nose. And then you have the mouth and oropharynx. The oropharynx refers to the posterior portion of the mouth. Then you have the throat. I have the larynx, which is referred to as the voice box, and it's sometimes referred to as where the Adam's apple is, which is more pronounced in males than females. Now, the larynx is a very important landmark. Anything that is above the larynx is referred to as upper airway structures. Anything that is below the larynx is referred to as lower airway structures. So below the larynx, you have the trachea, which is the windpipe, and then you have the passageway that leads to the lungs. So now the epiglottis is a leaf-shaped cartilaginous structure that is above the vocal cords, and the main purpose of the epiglottis is to prevent anything that is not air from entering the lungs. That's the main purpose. The trachea or windpipe is more anterior, so it's anterior. Then you have the esophagus, which leads to the stomach, which is posterior. So these are the structures that we need to be familiar with. Now, oxygen and carbon dioxide are exchanged in the alveoli and tissue, and that's the function of respiration. So when we talk about respiration, it's the exchange of oxygen and carbon dioxide, and it can occur within the lungs, and it can occur within the cells of systems within the body. So we have pulmonary respiration, and we have cellular respiration. Now, air is inhaled when the diaphragm and chest muscles contract. Air is exhaled when these muscles relax. So the process of ventilation, which is the mechanical action of breathing, has two phases. It has the inhalation phase and the exhalation phase. One of these phases is active, the other is passive. Active means muscle use is required. So in the active phase, which is inhalation, the diaphragm contracts and the chest muscles contract. And when the diaphragm and chest muscles contract, it increases the size of the chest. So it increases the size of the chest, and a negative pressure is created inside of the chest when that occurs, and then air is pulled in to fill that space. So when a person breathes in, they are breathing
Hello, Ryan. We're not hearing you.
Oh, all right. Can you still hear me? I think my connection just went down a bit.
Yes, hearing you now.
All right, good. Did we get the inhalation phase and the negative pressure?
Yes, I think you cut out when you were explaining what happened when they inhale.
Okay, all right. So when a patient inhales, the diaphragm and the chest muscles contract, right? This is the active phase of breathing. When the diaphragm and chest muscles contract, it increases the size of the chest, and the pressure inside of the chest decreases. When that pressure inside of the chest decreases, a negative pressure is created, and then air is pulled in to the lungs to fill that space. And that pressure is negative pressure. So when a patient breathes in, they are breathing in with negative pressure. Now, exhalation. Exhalation is passive. That means that the muscles relax, the diaphragm relax, the chest muscles relax. When that occurs, it decreases the size of the chest. So the size of the chest decreases and the pressure inside of the chest increases, and that pushes air out of the lungs. So that is positive pressure. So what is key for you to remember is when a patient breathes in, it's negative pressure. That's the normal physiology of breathing. When a patient breathes out, it is positive pressure. Now, when a patient is breathing out or exhaling, you should not be able to see muscle use because the muscles should be relaxed during that phase. If you can see muscle use when a patient is exhaling, something is wrong with that patient's breathing. They are not in good shape. And that would be the respiratory system. Are there any questions before I move on to the circulatory system?
Yes. When you said you're not supposed to see any muscles when they're exhaling,
Yes.
what you mean by that though? What
All right.
exactly shouldn't you see?
All right. Have you ever seen a person having an asthma attack?
My son.
Okay. When your son was having his asthma attack, have you ever seen unusual movement in it close to his neck or chest area?
Think mostly it's chest area.
Right. So you see like the skin is being pulled in, right?
Yeah.
Good. So that is muscles being used. When a patient is having a asthma attack or something is obstructing their airway. So let's use asthma because your son has asthma.
Use pneumonia.
We're going to work with asthma.
All right.
Right? So when a person has asthma, something has irritated the ear passage, so it becomes narrow. Now, when the ear passage becomes narrow, when the ear moves through that ear passage, it starts to vibrate. That creates the wheezing. Now, the problem with the patient that is having an asthmatic attack is when they breathe in, they can get air going in to the lungs. But when they try to breathe out, because the ear passage is narrow, it pinches shut, right? So it pinches shut. So in order for them to get the air out of the lungs, they have to force it out. So they have to use muscles to force that air out. So you start to see muscles in the rib area, muscles in the neck. We call those accessory muscles of breathing. So that's not normal muscle use. So what is going to happen is if it is not corrected, they will eventually get tired. The muscles get exhausted and they get tired and they stop breathing. Right? So if you see them using muscles, it's not a good sign.
Okay, got you.
Yes, go ahead, Mr. Francis.
Actually, this is Jason McDermott. For some reason my mic is not working. Quick question.
Okay.
In terms of because as you know, this is COVID time, right? And you have to wear a mask.
Yes.
How does the mask affect the respiratory system?
I don't want to go into this, but anyway. The mask doesn't affect the respiratory system, because if you can breathe with the mask on, you shouldn't be having an issue, if that's what you're asking. So what I will say to you is, if for mask wearing, it's not something for you to wear 24/7, right? So for instance, when I go to the terminal to cover a shift, you're required to wear a mask once you're out on the terminal and moving about where other persons are. When I get to the occupational health unit, if I am the only person in the unit, I don't wear the mask. I take the mask off at that point. So I don't recommend wearing the mask 24/7, right? And if it's the surgical mask, you still can breathe properly, right? You still can breathe. So I don't know if that answers your question.
In a way, but when you wear the mask, yes or no, it creates added pressure on the respiratory system.
What do you mean by added pressure?
Because in terms of exhaling, you have to basically your respiratory system would have to work harder to exhale because there's
Okay, I see what you're saying. It depends on the type of mask. So if you have on a very tight fitting mask, then it might put some effort on you to push that air out. And it also depends on the person's lung capacity, right? Because all of us don't have the same lung capacity. It depends on how healthy the person is. So persons with poor lung capacity would not be able to wear a mask for a very long time, right? Because of their lung capacity. But a person who is in good shape, if the mask is not tight fitting, they would be okay.
okay. One last
So
question.
it's dynamic.
The carbon one, monoxide that we breathe out, dioxide that we breathe out. When you have on the mask, you breathe out less and you take in more, right?
Technically, yes, right? But I don't want to go down that road.
But all right, that affect the body negatively or positively?
Well, you have to have a balance of gas in the body, right? So you can't have too much oxygen and you can't have too much carbon dioxide.
So if
Right?
what you're supposed to do is actually taking in back a percentage of that, then that means that it wouldn't be good for the system, right?
Right. So if you're retaining carbon dioxide is gonna combine with water in the body, and that becomes carbonic acid. Carbonic acid will cause the pH to go down and become more acidic. If the if the pH becomes more, excuse me, sorry about that. If the pH becomes more acidic, then the brain function slows down and the patient will eventually go into a coma. So retaining CO2 is not good. And if you breathe off the CO2 completely, that will cause the pH to become too alkalotic, and that can cause abnormal muscle contraction. So neither of the two in excess is good. All right, Mr. Francis.
Yeah. It was actually Matt there, Matt.
Oh, sorry, Mr.
Yeah. Okay, I understand.
All right.
Yeah, man, cool.
All right, so let us continue to the next system. Oh, it's almost 10 o'clock. All right, we're gonna pause here for a break. Gonna take a 15-minute break and then we will continue with the human body. So 15 minutes. We will resume at 10:15.
Mr. Rufus, quick question before you go.
Yes.
Earlier you spoke about passive. Use the term passive. Could you just repeat what you had said earlier, just quickly?
Okay. Right. So there are two phases in ventilation: inhalation and exhalation. The inhalation phase is referred to as active because muscles contract during that phase. And the exhalation phase is referred to as passive because muscles relax in that phase.
Thanks.
All right.